So before moving to Wales, I worked in England for about more than a year over there, and I believe in terms of training in Wales, the opportunity is a bit more than England, and the support available over here is far better than England. Especially, you know, a lot of consultants over here, and I think they're more friendlier as well. And you know, especially if you work in smaller hospitals over here, so you know literally everyone in the hospital, and they're more friendly, and training opportunities are, I think, a bit better than England. Especially in England, the doctors are a bit more in number, so you get lesser opportunity to do procedures and do other things which you're able to do in Wales. I think in terms of training, the opportunities are more in Wales as compared to England and Scotland. Being a junior doctor, you're not able to take annual leave or study leaves on time where you need it, and one reason is, I think, that it's because of the understaff or short staffage, due to which you're not able to take leave when you need it, basically. So sometimes you have to really divide into different days or random days which you take, and that's not helpful. I think that's one of the main reason over here, which we are facing. And the other reason, I think, at times it's a bit more stressful. Especially you have to work long hours. If you're supposed to be finishing at 5, mostly you're not able to 5. The reason being that there are a lot of patients, and I think there are less doctors, so you're always struggling, and sometimes you're not able to even take breaks in between as well. The staffing level is, I think, a bit an issue over here in Wales, so I think as long as that is not sorted, I don't think if the annual leave and study leave things can be solved at all. So I think that's a major issue, especially for being a doctor below ST3 level, because we need fixed days as well, just like registrars get. We need some days off just to do some study and focus on things. So at the moment, like at this level, I believe I have the knowledge and skills I'm able to do things which I should be able to do. But as you progress, I think you need more skills and more experience. One issue which I feel over here in Wales is, I think for example, in England, there are a lot of conferences, a lot of workshops in different areas, for example, Manchester, Birmingham, London. I think the number of conferences and workshops are a bit less in Wales for trainee doctors, although the deanery does provide them, but I think overall the number is less as compared to England. And like this year, I have booked at least 2 or 3 conferences in England. So literally, like, you have to travel to England to do something which you can't get in Wales. There are 2 or 3 factors, like, to be honest, you have to take into consideration. So most important is, if you want to improve your skills, like in terms of opportunity for being a junior doctor, I think the opportunities are more in Wales as compared to England or Scotland. You have more opportunities and you have more hand-on practice over here. Then if you talk about family life or social life, I think it's a bit better in England than what we have in Wales. So I think that's the downside over here. Then the friendliness or the working environment is, I think, it's a bit better in Wales as compared to the other parts of UK. Scotland, they have 2 Royal Colleges. There is a Royal College in England, so they have more exams in Scotland and England as compared to Wales, especially the MRCP exams. So like, if they can facilitate those exams over here, and then if like junior doctors can have more conferences, workshops sort of things, so we can get more CPD points instead of traveling to England and somewhere else for these kind of workshops and training conferences. So the main aim was to facilitate junior doctors and to improve working environment and the level of care we provide to patients.